Hi, my name is Daniela Fasulo. I am a respiratory care practitioner at the McCarroll Institute of Health and Research, and today I'm presenting on OSA patients and how pulmonary function tests can indicate increased work of breathing during sleeping and how important it is to utilize a medical device while sleeping to improve quality of life, fatigue, and sleepiness during the day. So today we're going to be talking about what OSA is, PFTs, how it shows increased work of breathing in OSA patients, and how important it is to properly use a CPAP machine in hopes that it will improve quality of life. Obstructive sleep apnea is a condition when individuals who are sleeping start choking, they're snoring, or they're not breathing at all due to a narrowing or blockage in their airway. It's usually due to an anatomical issue in the upper airway, like the nasal passages, the mouth, the tongue being too big, head shape, or even in the neck. So when the muscles relax, it causes an obstruction. So a way to diagnose OSA is by using pulmonary function tests. PFTs is a wide range of tests that help diagnose all lung diseases. It determines whether the disease is obstructive or restrictive, and it helps determine the severity of the disease. The gold standard for diagnosing OSA in PFTs is polysomnography, and this is basically a sleep study. So they diagnose it through utilizing your oxygen levels in your blood, monitoring your heart rate, and seeing the wavelengths in your brain. It also measures your sleep patterns, make sure that we're measuring your eye movements and your leg movements. If the doctor wants to be specific to see if it's an upper airway issue, they can also do a test that's called IOS, which is impulse oscillatory, and that helps measure the resistance of the upper airway obstruction. So the reason we see increased work of breathing in patients with OSA is because they have a lot of hyperinflation, which PFT shows, which is in the residual volume, and basically air is getting trapped in the air sacs that's not allowing CO2 to be properly exposed of. And so as the CO2 levels rise, it sends a signal to your brain that your body is not doing a good enough job to get rid of the CO2, which in turn makes your breathing rate go up. Your muscles start coming into play, like nasal flaring. You'll see your muscles in your ribs, tracheal tugging, and belly breathing. So with all that being said, we conducted a survey to find out how OSA patients understand the level of their disease and their compliancy with wearing a CPAP device. 40% of our surveyors said that they had only been diagnosed with OSA for less than a month. Patients that said they did experience symptoms while sleeping was increased respiratory rate, which was 33.33%. 80% of surveyors say that they experienced snoring while sleeping. It appears that a moderate amount of knowledge is known when it comes to PFTs at 40%. And we see that 86.67% of surveyors say that they have been prescribed a CPAP machine. And within that 80%, 57.1% of surveyors say that they feel about the same if they use their CPAP machine versus not using it. The National Institute of Health put on an article that states even though CPAP helps reduce mortality and morbidity and improves cardiovascular health, 50% of patients do not utilize their CPAP machine, or they discontinue it within the first week. Here's an example of what a CPAP machine looks like. As you see, it's small, it's easy to move around. You just plug it in to the wall and you put on the mask. Arguably, picking an appropriate mask is what's going to help when it comes to comfort and effectiveness of utilizing the machine. As we see on the left, we have a nasal pillow, which is usually the most comfortable. However, if you move a lot in your sleep, it can easily come out of the nose, which in turn will make the machine ineffective. And on the right, we have the oral nasal mask, which would help bypass any tongue issues. However, it can be deemed uncomfortable. Picking the right mask is imperative to effective wearing and utilization of a CPAP machine. Thank you.